Are we live?
We're live.
Okay.
We are live.
What's happening? All right, is it time to drink? Can I start drinking this red wine? All right.
I know Dr. Sarna said it tastes like sugar.
Oh, it's so good. So good. We have this one to thank for this wine we're drinking. But anyway, I'm Dr. Weiss coming to you from Paradise Medspa, and this is my partner in crime, Janet Fales. And we are here for another session of Wine Down Wednesday. Hooray!
Yay! So glad you could join us.
Yeah, so we are going to be talking today about turkey necks just in time for Thanksgiving.
Absolutely.
Yeah, and we're already celebrating.
I know.
Yeah, cheers.
This would be a really, really good wine for Thanksgiving,
Oh,
I'm thinking.
It's delicious. So Janet's going to tell you all about it. Do we want to do that first, and then we'll go into our monthly specials?
Sure. Let's
Okay.
talk about it, because this is one of my favorites. It's called Pessimist. Well, they hit it on the mark with this one, let me tell you. This is a 2019 Pessimist Red Blend. It's actually from one of my favorite regions, Dr. Weiss's too, Paso Robles and California.
Or Paso Robles. We have this discussion every time.
Robles. But it's a great part of California anyway.
Yeah,
and they
you gotta
make
have a
great
chance.
wines there,
You
right?
need to go.
Okay, but here's the interesting thing. Dow Vineyards is who makes this wine. And it's made by two brothers. They're the vintner owners, operators. And they're originally from Lebanon. So their mom was from France. The family was living in Lebanon. And then we know there was a civil war there. Probably many civil wars. But I'm not too sure about that though.
I'm sure
but there's always turmoil there.
Yes.
Anyway, in 75, the family just finally decided we need to get out of here. This is not a good thing going on right now. It was dangerous. So they moved to the south of France. And that's where they started to kind of learn about, vineyards and wines and stuff like that, even though they were young boys. So fast forward, they end up moving, the two boys end up moving to Southern California. They both attend UC San Diego. And one of them was both of them were in engineering. One was like computer and one was like electrical engineering. So you're like, huh, what? Well, they gathered up their money after college and they bought property in Paso Robles. And it has a very similar client, or a terroir or something like that. I'm not very good at saying it. But it's where the land, the environment, the climate, and everything is conducive to producing these types of grapes. So I mentioned that it's a blend. It's a blend of Syrah, Petite Syrah, Grenache, and Zinfandel.
It's delicious.
I love it.
And I love
it's
the color
dry,
of it.
but not too dry.
It's a real dark.
And it's got some nice blackberries. It's got, what else does it have? Black raspberry, currant, and blueberry in it.
Yeah,
So I
it's
think
really
it
good.
would go good with a turkey and some dressing.
Smell and taste the blueberry. It's
Yeah.
really delicious. When I poured it, it was like, oh, it's dark and lovely.
Yeah.
I love it. And then I wanted just to give a shout out to some friends and patients that brought me this bottle of wine today. They brought it to me in honor of Wine Down Wednesday, but Janet, we had already decided on the Pessimist and cracked that bottle open. But this is a beautiful bottle. I have no idea it's French, and my friend is French. But it's from Bordeaux, and it's a 2016, and I can't wait to try it. So thank you. You know who you are. Okay, so what else we got?
So we have specials. We have so much fun stuff going on right
That's
now.
a fun month.
Yeah. Well, today's November 10th, so tomorrow is November 11th.
11/11 day.
11/11. Yep, we're celebrating the 11s, and Jubot.
Celebrating getting rid of the 11.
Yeah, getting rid of the 11s. That's right. We don't like those
We don't like the
11s
11s.
there. No. So Evelis, the makers of Jubot, are have called it 11's Day. We want to get rid of those. We've got some great specials. We've got $80 off your Jubot treatment, which is a neuromodulator similar to Botox, Dysport, Xeomin. It's just another one on the market that's one of the newer ones.
It's the newest
It came
one
out
that's
in
FDA approved.
2019, right?
Yep.
So,
And patients are loving it.
yeah, and our patients, not all patients, but not all patients at other practices. Our patients get $80 off on their treatment of Jubot as long as they're getting at least 40 units. And then we have these cute little giveaway bags that we're giving out while supplies last. And you know, that $80 special is tomorrow, but also, you guys, it's good through December 31st.
Yes,
So-
while supplies last.
Yep, while supplies last. So if you can't get in here tomorrow or don't already have an appointment tomorrow, I think Ciara's already booked.
But I'm telling you that $80, the stuff is flying off the shelves.
Yeah.
Yesterday I did Jeuveau all day long. You should know that there are some rules. 20 units or more will get you $40 off. 40 units or more gets you the $80 off.
Mm-hmm.
So it was a great way for patients to try a little bit more too, a little higher dosage or a new area. We're finding more and more so that dose and duration go hand in hand. So it's a great way if you're not used to using dosages of 40 or more, which isn't unusual. Actually, on label for crow's feet, midbrow, forehead is 64 units.
Mhm.
So 40 units or more should not be a big deal. It shouldn't be scary to you, and your treatment might last longer. So it's a great time to try it at a discounted price.
I think so. I get 65 units.
I get 100 units.
So
Actually, like at this point, I put an entire, and I used Dysport on myself most recently, but I used an entire 300 unit, and that's equivalent to 100 units of Botox.
right.
Because I treat everything from here down. So,
Yeah. We'll be talking more about that today.
yes.
Right? When we're talking about necks and stuff
We
like
sure
that.
will.
In that same vein, November 17th is National Botox Day. And actually, Allergan, the makers of Botox, has declared the 15th through the 21st National Botox Week. So the really cool thing is about that week is that everybody gets double Alley points. So if you typically get Botox or Juvederm, you know, any of those products made by Allergan, you can earn double points by having a treatment that week. We've still got a couple of appointments left, but there really aren't many. So if you haven't got an appointment and you need one, give us a call. Charlie's answering the phones right now, and she'll see if she can fit you in.
And
'cause
if
those
you
are
don't
going
know,
fast.
Allie is the reward program for Allergan, whom is the manufacturer of these and distributor of these products. So, so if you don't already have an Allie account, ALLE with a little line over it, go on their website and sign up for an account because you will earn points for every treatment that you have in our office, and those points can be redeemed your next time.
List product, which is Jeuveau, or Dysport, which is a Galderma product. Okay, so more fun stuff coming up, but this one's gonna be a little bit of a mystery, ladies. Black Friday, Cyber Monday, stay tuned. We're gonna be having some a great offering out there, and I'm gonna back up. So yeah, stay tuned for Black Friday and Cyber Monday. I'm gonna back up a little bit to National Botox Week. Not only do you get double points with Alley, which is their rewards program, but
Wednesday,
they're going to have a special offer out there. Buy a Botox $50 gift certificate and get one for the same price. So it's a buy one, get one, $50. It's not to use on your treatment that week. It's for a future treatment. But it's a great deal.
Yeah.
Why not take advantage of free
getting
money?
100 units,
right?
$100 worth of Botox for $50.
Yeah.
So, and in years past, that deal has blown up their website. So get on their site early, and if you have trouble getting through, keep trying.
Yep.
So that's an amazing deal that Allie is offering. And then for going back to Janet's sneak peek at our Black Friday, Cyber Monday deal. If you have been a long-standing patient of ours, you know we always run a really good online deal for gift certificates that day and that weekend, and we will be doing something similar. So if you kind of know us and love us and you're waiting for that deal all year long, now's your chance.
Yeah.
Okay?
Yep. Wonderful. What else have we got going on? We have our skin insurance program. A lot of you know about our skin insurance program. It's a great way to bundle buy your services, maintain your skin, keeping it looking radiant, beautiful. It runs $999. That gets you 6 treatments that have no expiration date. Right now, we are, for anyone who signs up, we are giving these 2 products with the sign up of the skin insurance program. They are from Wyco, which is the PRXT post-care products. One of them is the facial smoothing fluid, which is glycolic acid. And then the other one is their moisturizing cream, which is for dry skin. And it has shea butter in it. Everybody
feels so good.
who's tried it loves it. So you'll be getting free
Gift
full
with purchase.
size gift with purchase on that. So that's kind of exciting for November, only available in November. And then we also have Super B injections to give you that little bit of extra energy that you need to get through the holiday months. They're being offered for $25. Normally they're $35 a piece. But you can come in weekly and get these Super B injections just to give you that extra boost and help with the stamina of the holidays, dealing with the holidays. And then I wanted to make sure, because I always forget to talk about this, next month, Wind Down Wednesday is going to be on December 8th. It's going to be with Dr. Christine Sarna, Elfie Clausen, and then also our BioT rep, Jennifer, and they're going to be talking about bioidentical hormones.
Awesome.
So that's really cool, very informative. It always amazes me how many people aren't aware of what bioidentical hormones can do for them.
Yeah.
And just how easy it is to just go through your checkup, get started, and start feeling better right away.
Okay.
So those
Get
are
rid of
our
your hot
specials.
flashes just in time for the holidays.
Yeah, sleep better, get rid of your hot flashes,
Okay.
better quality of life overall.
Excellent.
All right, so that's what we got going on.
Okay, that's a lot. That was a mouthful.
Yeah.
Okay, so let's jump right in. Hopefully that has given you all a chance to grab a beverage and sit down and get to the meat and potatoes. Get to the
Yeah.
turkey and potatoes of it.
Yeah.
So we are going to be talking about next today, and I thought there's so many different treatments, and this is such a problem area for so many people, including
Mhm.
myself.
Mhm.
I feel like once you hit 40, it's like you can't see anything besides crepey skin on your neck, if you're
Yeah.
like me. So anyway,
Or me.
I never understood it in my 30s. What happens, and with our profile especially, is happening at the jawline level. So right at that border of when your neck starts and your face stops. So ways to address that: if you have any recession, if you've got a soft chin, we like to call it a soft chin. When your chin is recessed at all, it will make you look more like you've got a double chin because you don't have as much space from the tip of your chin to the angle of your neck here. So giving yourself a little more anterior projection to your chin could really help your profile. And a way to check for that is if you draw a line from the tip of your nose to your chin, it shouldn't intersect your lips. It should go in front of your lips.
Mm-hmm.
So if your lips are protruding in front of that, usually it means the angle is too tight.
Too short.
Too short. So, so that's a way you can kind of look at yourself and sort of assess. So if the angle is back further, usually means your chin has a little recession, and you might benefit from a little bit of filler in the chin area just to build that up. It may also present itself with deeper marionettes. And then you can give yourself a snatched jawline by adding a little bit of filler definition along the mandible here, along your jawline, the bone. So again, just to give you that nice shadowing on the side of your neck.
And that helps with that V shape too, right?
Well, not
Or
so
not
much the
necessarily?
V shape. What
Okay.
can help that is treating your masseters
Oh,
with
okay.
Botox.
Whoops,
So
I
if
took
you've
us
got-
another-
That's all right. If you've got, it's all part of the jawline. I mean, if you've got a squarer face, like I do personally, I have to treat my masseters with quite a bit of neuromodulator. So treating here, I tend to be a clencher at night. It hypertrophies my masseter muscles in the back here. And I know that because every time I go to the dentist, they're hounding me to wear my night guard, which I don't do as well as I should. And it gives me more of a square appearance. And then when I use neuromodulators, Botox, Dysport, Jeuveau in this area back here on this muscle, which if you clench your teeth, you can really feel it. Put your fingers back here, you can feel it on yourself. It will make my face look less square and more oval, which is more attractive looking.
Okay. For women anyway.
For women, and yes, men like that more square look. One thing, just as an aside, in older women, if you have a lot of skin laxity, skin bunching along your jawline already, you don't want to reduce the masseter too much, because then that mass of the muscle is pulling that skin back, and if you reduce it too much, it'll fall forward and can actually accentuate your jowls a little bit. So you just have to go to someone knowledgeable on how much to use and where to inject. So that's masseter. So filler, Botox, filler along the jawline, perhaps even a little Botox in the chin, in this mentalis muscle, because if you have a very strong mentalis muscle, and this gets stronger as we age, we tend to pull in here, and it gives you that orange peel look on your chin, that bumpy look, and so you can smooth that out and actually give yourself a little bit of downward and forward projection to the chin by putting some neuromodulator like Jeuveau or Botox into the chin. Corners of the mouth, the DAO muscle, which pulls the corner of the mouth down, you can kind of turn your frown upside down with a little neuromodulator. So that's sort of lower face leading into the neck. So then the next thing is Kybella. Kybella is a medication that we inject. It's an injectable medication. And we use that. It's on label to treat submental fullness, so double chin, fullness underneath the neck here. But we use it off label quite a bit in the jowls here also to debulk the jowls. It's kind of a cruel trick that nature plays, is that as we age, we lose fat in our mid-face and we stop making collagen, so everything falls to the jowls. But not only that, the fat in this area hypertrophies as we get. It's so not nice. So you can reduce that fat, and it's actually permanent. Once you kill fat cells, they're gone for good. So reducing the fat volume in the jowls here and here can make your neckline look better.
Sure.
And can also give you that more, if you look more round because you've got this fullness here, you can reduce that along with the masseter to give you that more oval look to the face. So a little bit of Kybella. The other thing to consider is pedio threads.
Yeah.
So pedio threads placed in the lower face, in the neck, even those are the lifting threads to kind of lift for skin laxity and reposition tissue, can make everything look a little better and lifted, but also smooth threads. Smooth threads I'm using more and more in underneath the chin and in this area in the anterior neck where we get this crepey bit to help as a collagen stimulator. So putting some of these smooth threads, almost like a hashtag pattern, to act as scaffolding for new collagen. Pretty much after the age of 40, 45, we stop making collagen. So we need a stimulus, something like these smooth threads to make our body kind of jumpstart things. And like a controlled wound to the skin or a foreign body like the threads are, to tell our bodies, hey, we need collagen, we need healing in that area. And so those threads are a nice way, easy way to treat that. The other thing you can do is use injectable collagen stimulators like hyperdilute Radiesse.
Right.
Hyperdilute Radiesse is Radiesse, which is a filler that has collagen stimulating properties to it. And I feel like I'm gonna sneeze. And here it goes.
Bless you.
So I felt that one coming from my toes. So Radiesse, which can stimulate collagen, and if you, the hyperdilute is when you actually use saline to kind of blend it to thin it out a little bit. So you're not using it for its filler property in this area, you're using it really just for its collagen stimulation property. Through this area will help a lot for that crepiness. Sculptra is another option.
Yeah.
So using those types of products in the neck for that crepey skin. We talked about pedio threads, energy-based treatments. We haven't really touched on that.
The other thing that I was going to ask, since we're on the subject of neuromodulators and fillers and whatnot, is what about micro Botox?
And platismal bands.
And platismal bands, yeah.
So Botox, Janet brings up a really good point, two things. Botox for the platismal bands, I just treated mine, but you can still see I could probably use some more.
Me too.
In these bands, these are actually muscular bands, and you can treat those with neuromodulator like Botox or Jeuveau or Dysport, and a lot of people have these pronounced bands. So sometimes people think they have skin laxity, but really it's those muscular bands that traverse the neck. You can treat with Botox really easily. You just pinch, put a little, just a couple little injections along the length of them, and they disappear. So I love using neuromodulators for that. But you can also use something called micro Botox or microtox. It doesn't pick your tox of choice. And you can It's a little more, it's less concentrated form of neuromodulator, and you inject it pretty much from the lower face down the neck. We use about 60 units total of neuromodulator, and I call it microtox tightening. It really does a nice job of, you're injecting it more superficially, just tightening, just ever so slightly improving the texture of the skin. So in that case, we're not injecting it into bigger muscles, we're injecting it actually into the skin to tighten the skin and improve texture and
the
laxity,
quality, right?
the quality of the skin. Botox is amazing. There's actually so many things you can do for it. You can also use a stamping technique, like with the microneedling device that has a little reservoir that you can stamp the Botox in, mixing it with a little hyaluronic acid to help for pore size, oil production on the skin. It's really quite amazing, all the things that you can do with neuromodulators. So you can certainly do that here as well. The energy-based treatments are more so to address skin laxity and discoloration. So there's something called poikiloderma. If you look at your neck, that's sun damage, and I think Janet might have a little bit of that brownish, reddish pigmentation changes on the neck from sun damage. It's called poikiloderma, and that is something that's treated very nicely with IPL or photofacials. So that device targets anything brown or red in the skin, broken capillaries and things. And this is very vascular. It's a lot of little broken capillaries that come up. It makes your neck look more red or brown. And so we use our IPL device to treat that. The other thing is RF microneedling, which is probably my favorite energy-based treatment for the neck to help for skin laxity on the neck. It's a combination of radio frequency, which is a heat-based energy, and microneedling to drive that energy into the skin to tighten the skin. And the downtime is minimal. You look a little pink for a day, but it's very effective. Done in a series, like most energy-based treatments, especially those that have little downtime, you need to do in a series, typically 4 to 6 treatments for best results. But the results are really nice and noticeable. And certainly you can combine IPL with RF microneedling. And then the other thing is fractional CO2 laser. So fractional CO2 laser, whether you want to go for a deeper treatment or the cool peel, which is sort of a lighter, more superficial treatment, depending on how much skin laxity you have. Great way to address all of those factors: pigment, laxity, texture on the neck. I love a CO2. If you've heard me talk before, you know is still like my favorite anti-aging laser. But you have to have a week to heal. Yeah. On the neck skin takes longer to turn over, so you will look red longer on the neck than the face. So on the face, I say it's about a week of healing for CO2. On the neck, you're looking at maybe 10 days. But well worth it if you can find the time in your schedule. If you can't, then doing the combination of RF microneedling with IPL, great alternative. You just need to do several of them. No big deal. Not a big, not accentuating the downtime very much.
Right. Yeah.
Renuvion, I think, is the last thing. So if you really have a lot of skin laxity, or a combination of skin laxity and a bit of fat, you can do more invasive treatments where I'm working underneath the skin. I make a little incision, like just in that little area right underneath the skin where we all have a little, almost like a little scar, but it's not. Yeah. It's like you can all feel underneath yourself there. And behind the ears, we hide they're just little needle pokes, really. Very small little stab incisions, we call them. It sounds like horrible, like I'm stabbing people. But anyway, we sedate you while I stab you, so you don't feel that. But I numb the area with local anesthetic, and I'm working underneath, so subdermally, to tighten skin with, in the case of Renuvion, which uses plasma energy to tighten the skin. And I can also use the Vaser device, which is something I use ultrasound for liposuction. So if you've got a little bit of like a fatty pocket here, I can remove that at the same time. Yeah. So that's a little more invasive treatment. Downtime with that, you're looking at a couple of weeks of being sore. You are in a compression wrap for a few days afterwards. So it's not something we're doing as often, because I think people are trying to avoid those more invasive treatments, and there's so many great non-invasive methods to treat that area now. that we're not doing as much of it, but it's still very effective. Renuvion has been shown to essentially shrink wrap the skin by 30% at a year after treatment.
Yeah. It's a
So
really nice treatment.
really nice. And with a teeny little incision and really very minimal downtime considering. Have we had any questions? I just like chatted. Yeah.
So, Linda's asking, what eliminates necklace lines?
So these necklace lines. So this is a harder thing to treat, but I do think hyperdilute radius. I think Sculptra. I think smooth threads put into those lines can help. There's Plasma pen. You're right. Plasma. We didn't talk on that, but you can. We just talked about Renuvion, which is plasma energy placed underneath the skin. You can use plasma energy on the surface of the skin to help for those lines as well. It kind of tightens the skin around those lines. So we kind of chase lines with plasma pen. I like plasma pen on the chest too. Hyperdilute radius, we didn't really get it. I won't keep going down the body, but you can do a lot of those things on your chest décolleté as well. But yes, I also love smooth threads because it's just so easy to throw those in.
Yeah, it's so quick.
Quick, easy. Throw some smooth threads in a sort of a mesh pattern in front to help tighten that loose, icky skin.
It's so thin there.
Ugh. And then addressing the necklace bands by throwing some smooth threads in there as well. You can use filler. You can use some of the thinner fillers. I've used Bellatero there. I've used Juvederm Volbella in those necklace lines as well. But be prepared to bruise a little bit. There's a lot of vascularity in the neck with injections, and I've been known to give a hickey or two.
Yeah.
Yeah. And then we didn't really talk about topical products, but we've got a couple here that are our personal favorites.
Yeah.
So, really the neck skin is different than the face skin. And while I always recommend bringing your products down onto your neck, especially your sunscreen, which a lot of us forget to do, but using a cream specific for the neck area is really important. Kind of like why you use an eye cream, which is different than the rest of your face.
Cream.
You want to use a special, because this area is thinner. Like I said, the cell turnover isn't as good, and it's more sensitive. We tend to break out in rashes and things with harsher ingredients. So you really want to find something that's made specifically for that neck skin.
Yeah, so we have 2 products. I love them equally well. We have from Definage the 6-week Perfection Neck Cream, and it's for the neck and the décolleté. And then we also have from Elastin, we have the Restorative Neck Complex. And both of these products are designed specifically for the skin on the neck, the chest, and they're designed to be used twice daily. So morning and night on freshly cleansed skin. And then you can put your sunscreen on over it during the day. If you use, any other moisturizers or whatever, if you need them, you can apply over. But
yeah, I like them both. I have been using the Definage because I use the Definage system. So I do use Elastin as well. I'm loving their new sunscreen, by the way. But I have been using that 6-week Neck Perfection and absolutely love it.
Yeah. So. And we carry both of these in our office, as well as you can order from our website. So under the shop tab, there's a link to each of these websites. You can order directly from the manufacturer and they'll ship to you.
It's really important for us that we carry products that are only medical grade, available through doctor's offices, not something you can buy at Ulta. So there's going to be more active ingredients in here, so you should see a change in your skin. These should be changing your skin on a cellular level, as opposed to the things you can just buy at the drugstore or the department store.
Or Amazon.
Or Amazon. You got to be careful with Amazon, especially if shipping to Arizona in the heat. I think a lot of their products degrade.
Yeah.
So 2 really great product recommendations.
Yeah, absolutely.
Okay.
And I think the more that you combine things, so when you combine your at-home care with the treatments in the office, you're going to get a better result.
Of course.
It's, and combining treatments. So doing the RF microneedling with a PRXT treatment.
Oh, I didn't talk about PRXT. PRXT is that dermal renewal treatment that we have is a great way to address the just tone, texture, brightening, tightening on the neck. And almost no downtime and no pain.
Right.
And is easily combined with a lot of those other energy-based treatments. I totally forgot. And microneedling, just plain microneedling, is also really good for the neck. Yeah. So anything you can do to stimulate new collagen.
Right. Yeah. And I think, you know, you've talked about this before, Dr. Weiss, so at the risk of repeating myself, combining procedures too, other procedures like doing plasma pen on the necklines and a CO2 right over it. We can do it in the same setting, you know, gets you further faster. It's like 1 + 1 = 3.
IPL with RF microneedling, filler or the hyperdilute radius or threads that are stimulating collagen underneath the skin, topped with PRXT or a CO2 or something to help more of the texture. Right. So you're sandwiching your treatments, something below and something above. You'll get further. So, you know, the more it's like throw the kitchen sink at it. You know,
right.
When you're talking about non-invasive treatments, it's not a neck lift, right? So I know we're always trying to find something that is less invasive to emulate a surgical result. We're not there yet, technologically speaking, right. But I think the more non-invasive or less invasive treatments you combine, the further we can get you there, closer.
Yeah, absolutely. And then if you're using medical grade skincare at home,
yes,
right, to complement what we're doing in the office here.
And really good sunscreen.
Yep. Yeah, definitely. SPF 30 or greater.
Make sure you're getting your sunscreen down onto your neck.
Yeah, even in the winter.
Yes.
You know?
I burnt myself with a curling iron recently. I don't know if you guys can see. Horrible.
Yeah.
Anyway, I've been loading the sunscreen on it because I'm like, oh, it's gonna leave mark. I'm just gonna cover that up. I clearly don't know how to do my hair. I can do other things. I can do lots of injections, and lasers, but obviously can't curl my hair. I didn't go to beauty school.
That's why we have Betsy.
Yes, exactly. That's why we hire people. What else we got? Tell me about this thing, Janet.
Okay.
What is this?
So this is our giveaway for this Wind Down Wednesday. What it is, it's a lay and go bag. This is courtesy of Galderma, the maker of Restylane products, Disport, Lift, Refine, Define. And so it's this really cool travel bag that you lay out and you can put all your cosmetic stuff in it. But look, it has goodies in it, yay! So we've got some blending makeup sponges. We have a daily eye gel mask. So this is the kind I think that you put in the refrigerator or freezer or refrigerator. And then you put it over your eyes to just chill out, relax, reduce puffiness, cool your jets.
That's what we should have had over the weekend.
Yeah. Yes. And then there's also a glow kit from Anastasia Beverly Hills.
Oh, that's actually really nice.
Neat
show them.
products
I'm gonna
in
be
it.
very white.
Yeah, you can do that.
I'm gonna do that.
And a little makeup brush.
Look at this.
But yeah, this bag is so cool, and then it keeps your sink from getting
bronzers
messy.
and stuff.
Mm-hmm.
Yeah. So who gets this, Janet?
Well, this
How do they
goes
win?
to anybody who chimes in with a question or a comment this week on Wind Down Wednesday.
Excellent. So
And
make
it
it
just,
worth your while.
watch this. All your
spend some
goodies
time
can
with
go in
us.
here, and then it cinches up really nice, so it makes it really easy for travel.
Okay.
And you're ready to go. And I just tucked this in here. So thing in here, and it's on this nice little
Remind me,
cute
who
pouch.
gets this one?
So that one, that goes to anybody who gets a Jeuveau treatment between now and the end of the year.
Until
while
now and we
supplies
run
last.
out.
Yeah, now
Did
we
you
run
already
out.
show them what's in there? So you get a
I
headband.
didn't.
So when you're washing your face,
Mm-hmm.
you get a cute little mask.
And I think the bags are a little
Those are
different
so
too.
comfortable.
Yeah.
Mhm.
Oh, they are. You get a little. It says "My
Mirror.
Happy Face Mirror." How cute is that?
And there's a hair tie.
I love Evolus. They have the cutest stuff. And then a little hair tie. I love these little elastic.
So not only can you get up to $80 off your treatment, $40 or $80, but you also get this cute little bag.
So
At least why we have the
Love
cute
it.
little bags.
I love. They have such
Yeah.
cute marketing.
Oh, I know. I love the colors and everything that they use.
Yes. So thank you, Evolus, for treating our patients.
Yeah.
All right. We already talked about what we're doing next month. Have we had any other
know.
questions for us?
So Jeannie was just wondering about costs on procedures that we're going over, but I feel like,
We talked about so many things that honestly I think the best thing to do is give Janet a call if there's something in particular you have questions about, and we can give you exact pricing on it.
Yeah.
You know, everything.
And it's so
is just
customized.
So customized, and it varies between all of those things I shouted out. So Yeah, that's a hard question.
Yeah. Yeah, it would take me like another hour to go through the list.
Yes.
So yes, please call me, email me. You know, I'm here. I'm in the office.
Could range from $250 to $4,000.
Yeah. And anywhere in between.
And anywhere in between.
Yeah. But that's a good range.
This wine is so delicious.
I know.
So again, we're drinking Pessimist for those who missed us in the beginning, and it's delicious. Go get it.
I can smell it. It smells so good. Right when you opened it, everybody was like, oh, yeah.
All right.
And then Monica just says hi from Scottsdale.
Well, hi. Hi from Phoenix. Excellent. Hopefully we'll see it's our busiest time of year. So please be patient with us if we don't get your phone call, if we can't get you in right away. Everybody needs to look good for the holidays. I saw something online. I was just laughing about it because I was like, someone was like, oh, what, like, why is it that we all feel like we need to look good for the holidays? Like our family cares. Why do we care?
Pictures.
Well, you know what
Pictures.
it is?
Social media.
Is it the holiday cards we send out?
No, but it's also for a lot of patients.
Could
What I
be.
hear for them, they're getting together with extended family, and unfortunately, some of them they're not really looking forward to getting together with. Some of them, who are a little bit overly critical, so they want that extra armor to go to these family gatherings and look and feel their best, so that they can.
I would
deal
choose
with,
another family.
with those. Well, it's not
If
their
only
whole
we
family.
could. If only we could.
It's not their whole family.
Yeah.
It's just some of their
Your
family members that are
select
only
family members.
Crystal. And so they want to go and they just want to rock it and they want to feel really good while they're there and have a great time. So
We want to give you one less thing to worry about.
Yeah.
So we want you to look in the mirror really every day and feel and look fabulous. So
absolutely.
isn't that what it's all about?
Yeah, it's all about the love. That's
It's all
what
about
we do
loving
here.
yourself.
Mm-hmm.
Yes, it's about loving yourself, looking in the mirror and feeling like, I got this.
Otherwise, you don't have it to give. Yeah. If you don't have
I
it
got
for
this.
yourself.
Yeah. So remember, that's what it's all about. It's not about your family member, your critical family member. It's about you looking in the mirror and feeling confident and beautiful and getting after it.
Yep.
Okay.
And we can help.
All right. With that, we're going to peace out and we'll see you next month with the
Ciao.
wellness team.
Yeah.
And I'll be back to talk your ears off again in January.
Yep. And
Okay.
we'll have something fun to talk about.
Yeah. All right, guys. Thanks for joining.
Bye.